We have 5 full-time athletic trainers with Salina Regional Orthopedic and Sports Medicine Clinic. We provide coverage for local high schools and colleges. Hi, I'm Nicole Balderston, and I'm lead athletic trainer with Salina Regional Orthopedic and Sports Medicine Clinic.
Well, Nicole, thank you so much for coming on the show. Why don't you tell us a little bit about the Athletic Trainer program?
Okay, yeah, thank you for having me. So at Salina Regional, we have 5 full-time athletic trainers that work with the Salina Regional Ortho and Sports Med Clinic. So just kind of briefly a little bit kind of what an athletic trainer does. They work with the prevention, examination, diagnosis, and treatment of emergent, acute, and chronic injuries and illnesses. Our athletic trainers, they go out to the schools, high schools and colleges, and then we also work in clinic. So the athletic setting is probably a little bit more common when you think of an athletic trainer. That's kind of what you think of when you see an athlete go down out on the field. They're the person running out there to evaluate that athlete and kind of make that game plan in that situation. So our ATs that go out to the schools, they go out there typically in the afternoons. They're going to be there before that practice or game or athletic event, and they're going to be preparing the athletes for that practice. So whether that's taping, the athlete, ankle tapes are pretty common, that sort of thing. And they're also going to be doing rehabs and treatments on those injured athletes. And then they're going to be there throughout that practice or game. And kind of like I said, if anyone were to get hurt during that athletic practice game, they're going to be the ones acting as that first aid responder and making those decisions on how to take care of that injured athlete. And then they're going to be there after that practice or game and do any kind of post-practice treatments and rehab. As far as being in clinic, all of our ATs also are in clinic. In clinic, we're going to do all of the splinting and casting. So any kind of fractures or that sort of thing that comes in, we're going to be the ones splinting and casting those patients. Additionally, we also do all of the home exercise programs. So like a patient isn't going to formal physical therapy for whatever reason that may be, we're the ones coming up with those home exercise programs for those individuals. So they're able to kind of do those rehabs and stuff at home instead of going to formal PT. Along with that, we do work pretty closely with our PT clinic at Salina Regional, specifically for our post-op patients to make sure they're getting in to physical therapy and doing those rehabs to help with their recovery after surgery.
Nicole, thank you so much for coming on the show and for some great information. And thank you for watching. For more information, visit SalinaRegionalSportsMedicine.com and follow them on Facebook, Instagram, and Twitter.